Good morning. 86 degrees. It is Taco Tuesday. I've been MIA for a bit. Of course, the sun's been working early hours now, not late nights. I hope it stays that way. I'm not a really good morning person at all, but I like that he gets out early. So, you notice I posted on my community post about the darkest times in our lives, and that's exactly what I've been going through. This past Friday, I went in for my results at the doctor's office with this doctor that I have been going through HRT with, and let's just say that she told me something that I was not very happy about. Pause right there. Okay, ordered the tacos, got the tacos. So yeah, as I was saying, let me go this way so that I can take a longer route. Yeah, my results weren't what I expected, but it's nothing terminal. It's not the big C. It's just something that I'm just gonna have to do some life-changing adjustments with. It's changed my entire perspective on life now, and the way I look at everything. I'm having a hard time getting myself adjusted back to how I was before, because it's not going to be like the way it was before. I'm not going to share what it is because there are some things that, that you can share, and then there's some things that you don't want to share or you just don't feel comfortable sharing. But I just ask for prayer. I'm going to get a second opinion. I have another appointment with another. This time it's a specialist, an OBGYN specialist. It's not a nurse practitioner. So I'm going to get a second opinion, and if the same results come back, I'm more confident in this specialist being able to help me with my healthcare needs than I am with this other nurse practitioner who has had me on a cycle, on an emotional roller coaster, and doesn't seem to know what they're doing. What's more disgusting to me is the way I was treated on Friday by the nurse practitioner. She seemed very angry, very dismissive of me, very just not giving a crap. And all she did was had her assistant give me my results and just said, "See you in July," and just sent me out the door. Now, who would want to go back to somebody like that, Doesn't offer you any consoling, any alternative. She's supposed to be holistic. There was no mention either about when my next testosterone injection was, how am I doing on the estradiol. Nothing of any sort. Just see you in July. Her assistant, her medical assistant, she was also very hostile towards me at that point as well. And mind you, I'm sitting there with this shocked look in my face of what I was just told and the treatment that I'm getting. And I'm trying to ask questions. And the more questions that I asked, the more frustrated they became with me. They just wanted me out the door. There's nothing we can do for you anymore. Out. Get out. And listen, I know that with God, all things are possible. I know that, yes, use wisdom. Go to the doctor, but go to the right doctor. And whatever report that they give you, okay, great. That's what you found. That's what you think I have. Or that's what you say that I have. Great. But you know what? I choose not to accept that. The Lord said He will renew my strength. The Lord says that He has forgiven me for all of my sins. He took my iniquities. He has made me brand new. The fact that they treated me the way that they did just actually confirmed to me that it's time for me to go somewhere else. And that's what I'm doing, and I'm so glad that the Lord opened another door for me somewhere else, because it was hard finding someone else. The majority of the people where I live have bad reviews. The one place that I called yesterday to get an appointment, actually it was two places. One of them, they gave me an appointment only to call me 10 minutes later and tell me, oh, sorry, we can't see you. Your insurance said that you should go see a urologist. And I'm like, what? Like, my insurance? Since when does my insurance give medical advice? Like, I was so confused. And I was just like, okay, let me give them a call and find out, what's going on. And she was just like, okay, but I'm just telling you, we're not going to be able to see you. You'll have to go to your PCP, get a referral to go see your specialist, your urologist. And I said, you all have never even seen me. You have no idea what my issues are. You're just going by what I'm telling you, more or less. You have to look at my records, but okay. So I called the insurance. The insurance has no record of that office calling to check on anything. So what number she called, who she spoke to, how the code was put in, I have no idea, but it was done incorrectly. So that was a red flag right there. Okay, great. We don't want to go there. They're going to be coding your diagnosis incorrectly. They're gonna diagnose you incorrectly as well, And I was really shocked because that doctor had 4.8 stars. But then I looked at the lowest reviews, and that's where you really get the truth. And one of them had a similar situation as mine a year ago with the insurance. So I'm like, okay, so this is a pattern. This isn't anything new. So then I called the next person that I had that had 4.8 stars as well, or 4.9. And at first, the receptionist was very friendly. She's like, do you have a preference on who you want to see? And I said, no, ma'am, this is my first time. I'm not really sure. I just need to be seen. And she's like, oh, well, we have the 2 doctors and we have a nurse practitioner. Well, as soon as I told her I would rather see a regular doctor, a specialist for my needs, because I've already been through the nurse practitioner route. And I'm basically seeking a second opinion. I'm not sure why that would upset anybody saying that, but she seemed like kind of indifferent, if you will. And she's like, hold on. And I was just like, okay, not the response I was looking for, but okay. So I was put on hold. And I held on. And I was on hold. And I was on hold. 15 minutes went by. 20 minutes went by, finally. 30 minutes went by. And I was like, what is going on? I said, okay, let me give her like 5 more minutes. 5 more minutes. And she never came back. So I hung up. And then I called again. And I was put on hold again. Nobody even answered, mind you. Just put on hold again. They picked up the phone, placed it on hold. And I'm like, she must know it's me. They must have, their caller ID there. And she's probably like, oh, it's the same lady. Puts me on hold again. And I'm like, are you serious? And then 5 minutes later, they pick up and they hang up. No word. Just picked up and hung up. And I was just sitting there like, what? Are you serious? That was no mistake. That was an intentional hang up. Is this the kind of doctors that are around me here? Is this the staff they have working for them? Like, are you serious? I was furious by that point. So I got on the computer again. I had already spent all of Friday afternoon, mind you, and went to bed with a pounding headache, trying to find another doctor. And here I was having to do the same thing again yesterday. Finally, I saw another place with good reviews. I called. They took my insurance. And the lady on the phone was very friendly. And so I have an appointment now. Thank God. I scheduled it for mid-May because I wanted to give myself a break. I needed a break. I needed a break from all of this emotional stress that I've been dealing with for the past 5 months, going on 6. This cycle of madness with this nurse practitioner over here. And by then, I'll be done with the antibiotics. This round of antibiotics that I've been given again. And that way I can go with a clean slate and be like, okay, I'm done with all these. I want to see what you find. I want to see what your treatment would be, what your outcomes are. I want some hope now. it's just very sad to me that this is medicine now. This is the way medicine works now, where the doctors, you know, a lot of these doctors, they're almost non-existent. All you have is nurse practitioners and PAs. And neither one of them, and I'm sorry to say this, mostly are women that are caring for other women, and neither one of them are devoted to their practice. They're basically just using you as a guinea pig. Let's try this, let's try that, let's hope this sticks. And when things don't turn out the way they think they should, they're disgusted with you. Because that's a reflection on them being failures. They want to treat every woman as the same patient with the same treatment plan and not individually. Nowhere where you go is a one solution for everyone. It's not a cure-all. It's not an all-in-one. Everybody is different. And now that I remember, a huge red flag was when I was sitting there getting my blood drawn 3 weeks ago. I want to say 2 or 3 weeks ago. They were talking about yet another patient right in front of me, which they shouldn't be doing. That's a HIPAA violation. But they were mentioning how this patient said that she was still having some abdominal pain and some bleeding, but that something else had stopped. Some other ache that they were feeling. I don't remember all the details. I just remember telling my neighbor about it, the nurse, and she was in shock that they were even discussing that right in front of me. But all I was thinking at that moment was that lady needs to seek a specialist. They are not going to help her here. They're not equipped to. They're not, the NP there is not knowledgeable on how to deal with more critical issues, more ongoing, complicated, complex issues. She is used to somebody walking in, oh, I want birth control. Oh, here you go. Oh, I want testosterone injections. Yeah, sure. Oh, I need estradiol patches. Absolutely. Oh, I want my GLP-1s to lose weight. Sure. Oh, I want those things that you insert into your body, hormone therapy, the pellets. Oh, yeah, sure. Yeah, we can do that. Yeah. But if you go in there and say, hey, I've been having pain here. I'm not sure what it is. She does not know how to handle a situation like that. And just to show you a receipt, I went in there advocating for myself 2 weeks ago when I had my blood drawn, and I insisted on a urine test. And do you want to know that she fought me on it? Why? Why do you want a urine test? Just to rule out anything else. Just to make sure that I don't have anything else going on. Anything systemic. Anything, any bacteria that might need to be dealt with. That I might need antibiotics for. You know, why can't I have a urine test? Well, because your insurance may not cover it. The only way they'll cover it is if you're having pain, burning, itching, discharge. And I'm like, okay, I'm having pain. Okay then, I guess we'll do a urine test. Do you know that they found a UTI with me? On Friday when I went in? No, I'm sorry, it was before that. When I went in on Tuesday, because I went in twice last week. When I went on Tuesday, she said, yes, you do have a urine infection. We're going to give you an antibiotic to treat that. Okay. But can you imagine if I had not pushed that myself? Who knows how long I've had this urine infection? And maybe that's why I was having pain on and off. Along with the other pain that I was already having. You know, like, I just, she's not very thorough. How can you overlook every test possible? How can you not want to make sure to check all your boxes before you diagnose anybody with something? And basically tell them after that, I can do nothing else for you. Here. And dismiss a patient and say that you'll see them, what are we, April? 3 months later. Just like that. Why do you want to see me? I should have asked her, why do you want to see me in 3 months? Why? You're not going to do a follow-up on this after the antibiotics. You made that very clear to me. Because I did ask her. I said, okay, once I'm done with the antibiotic, do I come in again for another urine test to make sure that I'm cleared of the UTI? She's like, no, not unless you're having issues again. What? And what about the other thing that you told me about? No, not unless you're having issues. What? So, I should have asked her right then and there, then why do you want to see me in July? Do you perceive that I'll have issues in July? I want to know so that I can let my insurance know. It's just so stupid, so ignorant of her. I'm disgusted with this clinic. I'm disgusted with her as a nurse practitioner and as a woman from another woman. I am very disgusted with her treatment and her lack of knowledge. How can you sit there and call yourself a specialist in women's treatment when you don't know jack? Just because it's on a piece of paper? Because you got that doctrine? Because, by the way, she is a nurse practitioner with a doctrine. Did you cheat? Is that how you got this? Did you cheat in class? Nowadays, I will tell you to your face. I don't care what education you've had, what degrees you hold, what that freaking piece of paper says. If you can't show your intelligence, then I'm going to assume that you cheated your way through school. And that is how you earned that title. If you cannot put your money where your mouth is, you obviously, your mom and daddy paid for you to get that title. And you did not earn it. You didn't do the work for it. And you're still not doing the work for it. You're just wearing your scrubs with your name on them, thinking you're hot shit, charging people that are entrusting you with their health needs and their insurance, filling your pockets up, and you don't even give a crap about your integrity, about your practice, about your name. You think people are just stupid and will never catch on. Anyhow, my recommendation to anybody out there is make sure you do your research on any doctor that you go to. Don't just go to anybody. You can't even go by reviews anymore. 5 stars, 3 stars. No, you got to call yourself, find out for yourself, advocate for yourself. And hey, if you failed at the one that you picked, move on to another one. But keep seeking help. Don't stop, and don't take one word for it either. There's always hope. And to prove that to you, right here, that's a dove right there. I would always say my mom came back in the form of a dove to come watch over me. And there she is. Sorry, I got a little distracted, but there she is. And that's God's way of telling me there's hope. Dove. Jesus, remember? Anyhow, enjoy your Tuesday. Yes, I still have this here. I haven't taken it off. I love you all. Thank you for listening, and please keep me in prayer. Bye. Oh, another friend showed up. Remember this friend? I was talking to that friend right next to the dove. Nice.